Good afternoon, everyone. My name is Kim Bittner, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted on the NCC COVID webpage, usually within 3 business days. Many times we will have the recording up on the webpage well before 3 business days. Let's take a look at the agenda for today's call. Today we are pleased to have several individuals who have volunteered to discuss with us their decision and experiences with changing their kidney treatment option during COVID-19. The NCC recognizes talking about experiences during COVID-19 or any sharing of healthcare experiences may be considered protected health information. We want to thank our panel for choosing to share, and we appreciate your interest in this topic. Today, Eva Tak will be our moderator of a very robust panel. We will introduce everyone in greater detail shortly. Our topic for today is choosing to change kidney treatment options during COVID-19, a panel discussion. After our presentations, we will have time for questions and answers. Now, this does not mean you have to wait until the end of the presentation to ask your questions. As your questions arise, please submit them using either the chat or the question and answer feature through WebEx. Our goal is to answer as many questions as time allows. Now, before we get started with our presentation, we wanted to share with you a new resource that's been added to the website. COVID-19, a positive test or under investigation being prepared, is a brochure for in-center hemodialysis patients who have been diagnosed with COVID-19 or are considered under investigation. It offers questions to ask your dialysis facility or the cohort facility if you are sent to a cohort facility. There are also suggestions for maintaining your emotional well-being. Visit kidneycovidinfocenter.com and then select for patients. So, what is this call about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to share with others. And then this series of calls is available to you bi-monthly, offering a variety of topics. So let's go ahead and begin our presentation. At this time, I would like to introduce our moderator, Eva Tak. Eva was diagnosed with systemic lupus in 1984. She lives in California and has used in-center hemodialysis, peritoneal dialysis, home hemodialysis, and home nocturnal hemodialysis. Prior to receiving a kidney transplant, Eva performed her home hemodialysis treatments without the assistance of a caregiver. Eva received her kidney transplant just last year in July of 2020. For 21 years, Eva served as a police officer, and after leaving the police force, Eva completed a master's degree in counseling. She now has a private practice as a marriage and family therapist, specializing in working with emergency responders and trauma. She recently decided to go back to school to earn a doctorate in sociology. Eva also volunteers with the ESRD Network 17 and the National Patient and Family Engagement Learning and Action Network, which we also refer to as the NPFE-LAN, as a patient subject matter expert. At this time, we'd also like to introduce our panel. First, I'll introduce Darryl Reece, who lives in Tennessee and was diagnosed with kidney disease in 2006. His first form of treatment was in-center hemodialysis, and in 2011, Darryl received a living unrelated kidney transplant from a parishioner at his church. He received a second transplant in 2020 by listing on the transplant waitlist. Darryl volunteers with the ESRD Network 8 and is a patient advocate for his previous dialysis clinic. He says his proudest moment is surviving dialysis and building great relationships with other patients and staff at his unit. Darryl enjoys watching movies, cooking, and spending time with his family. I'd also like to introduce Timothy Ellis, who currently uses home hemodialysis. He credits his nephrologist for encouraging him to try home hemodialysis and the difference that it's made in his life. As a long-term diabetic, he knew about the potential concern to his kidneys, but did not have any complications until about mid-2018. Timothy's kidneys stopped working in 2019 after a year of health ailments, which included losing his mobility. Timothy battled homelessness, a minor heart attack, influenza, and pneumonia. He also regained his ability to walk. He found strength through online support groups and in his faith, which have helped him to find the courage to rediscover who he is through this new journey. Timothy enjoys photography, fishing, and cheering for his hometown Denver sports team. And last but certainly not least is Althea Lee, who is the caregiver for her husband. In 2016, they learned his kidneys were failing because of prolonged heart medication. In June of 2020, they began their journey with kidney failure and started in-center hemodialysis. Althea earned a master's degree in family and child therapy and started a successful therapy practice. In her spare time, she enjoys spending time with her grandchildren, gardening, photography, and spending time outdoors. She also enjoys helping individuals finding hope and helping them change their outlook on life. I would like to thank Eva for moderating, and I also want to thank everyone on our panel for spending time with us today and sharing your experiences. At this time, I'd like to turn it over to Eva.
Thank you, Kim. And I'd like to welcome everyone for taking time out of their day to attend this webinar. Also, I hope that this webinar will help you in your decision making when you evaluate your dialysis modality. So with that, I'd like to welcome Darryl to speak with us. And so Darryl, I have a question for you.
Yes, ma'am.
Are you there?
Yes.
Okay, great. So before we talk about your recent transplant experience, can you tell us how long you were on dialysis and what types of dialysis you were using prior to your recent transplant?
I was on dialysis in center, and each time 5 years apiece.
Okay, so how long were you on the transplant wait list?
Both times 5 years.
Okay, so you received your transplant somewhat early during the pandemic. So did you have any concerns with being on the transplant wait list during the COVID-19 pandemic? And if so, what were those concerns?
Well, of course, I had concerns. I guess you could say thinking that I probably wouldn't get a kidney during that time, because I know at one time they had halted surgeries and things like that. So, but as far as being, I guess, scared or fearful, no more than normal, because going through a transplant the first time, I kind of realized that it's kind of scary either way it goes, whether it was pandemic or not. And I knew that I would have to take the precautions I would have to take regardless. So it wasn't as bad as I thought, but of course, going into the hospital, you're of course scared because you don't know enough about the pandemic at that time. And mine was in May, so it was kind of still crazy. But I put faith in my God, of course, and put faith in the hospital. So St. Thomas is a great hospital here in Nashville, and I knew that they would take care of me. So it went well.
Great. So what, if anything, did your transplant center do to prepare you for the transplant, especially during COVID-19?
Well, of course, again, to give a shout out to St. Thomas Hospital transplant team, they've always kind of, regardless of a pandemic or not, they really was stern about how you take precautions and how you get yourself prepared. So I kind of felt at ease at the fact that I knew I would have to wear a mask and get tested before I take the surgery and things like that. So I wasn't really worried about that because it's a hospital. I'm a social worker and I've worked in hospitals for over 30 years. So I know the precautions that a hospital takes. So I felt safe coming into it, and I knew that they would take care of precautions they needed to do to keep me healthy and safe.
Okay. And was there anything besides that that you did personally to prepare yourself for going in for your transplant?
Prayed an awful lot.
I know that one.
Just kind of, so it was my second kidney. So, and this was a different one. Was a live kidney, my first one, and this one was a cadaver. So I didn't know as much what to expect once the kidney was in me, how long it would take. So you kind of mentally just have to get yourself ready to say, okay, if it doesn't work right away, don't look at it as a failure. Just kind of be ready to fight and do what you have to do. So I kind of prepared my mind for that. That's the main thing I had to do.
Okay. So you had two, like you said, one live, one cadaver, but I'm interested in your experience during COVID. So what differences did you notice receiving a transplant during COVID-19, and how did you cope with those differences?
The biggest difference is loneliness. You only, they limited so many people coming into the room, and my wife couldn't be there, and that was rough for me not having her to go through this process. They were very clean, very specific about who could come in, how you come in, keeping yourself away from folks. So that was the kind of weirdest experience for me, because it didn't happen the first time like that, and this time I had to get prepared for that.
So what recommendation would you make to someone who is thinking about going on the transplant wait list but is hesitant?
So I am an advocate for our center, and I talk to a lot of patients who don't want to think about transplant. The best way I can kind of encourage folks and tell them, understand that yes, dialysis, when you make it through dialysis, is a great thing, and that is a blessing, but there can be life after that, and that, you're in the best hands that you could be in to make sure that the new kidney works the best way. And you just have to understand that you have to do your part, eat right, take your medicine like you need to, understand that you can't put yourself in harm's way, stay away from folks that are, even if it's family members, if they stay sick all the time, you have to understand your body can't take that. So you have to practice and understand that it's worth it, because as much as I miss my family members, which I call the other patients, I enjoy going by the window and waving at them and not being on that machine. So.
Hey, thank you. Darryl, I wanted to ask you before we move on to the next panelist, is there anything else you would like to share with us?
I want to say that I'm grateful for Network 8 and the whole kind of national kidney foundations and things that they have. They helped me an awful lot. They helped me make this thing bearable. And I say to every patient that's out there that's still on there, know that you can make it, you can do it. I don't care what the circumstances is. Change your focus. Don't look so much at you being on the machine and having to change your life. Just change your focus I used to look at dialysis like my job. I had to quit my job. So this turned into my job. Every Monday, Wednesday, Friday, I had to get up to go to work. And then when I got off, I knew I was at home. So do whatever it takes to make sure that you can do the best job for you to make it through this. That's what I would tell them.
Thank you, Darryl. So, Timothy, I'd like to welcome you to the panel, and I have some questions for you.
Yes, absolutely.
Okay, yeah, because we're not visual, it's like I want to make sure the person's on the other end. So, Timothy, when you were diagnosed with kidney disease, what treatment did you first try?
When I was diagnosed with my kidney shutdown, end-stage renal disease, I was in an emergency situation in the emergency room. And so they immediately stuck me on a dialysis and started the in-center dialysis.
So how did you learn about home hemodialysis?
Dialysis in-center didn't treat me well. I'm a fainter. I have low blood pressure. I was getting migraines, the cramps, everything my 5 hours every session was miserable. And luckily I changed insurance providers and I got a new nephrologist, and he sat down, listened to me, and the first thing out of his mouth was, we need to get you in home dialysis. And so he became an advocate for me and convinced them to let me try it.
So what concerns did you have about starting a new treatment during COVID-19?
In the center I was at, I was in a unique setting, in a position in the building where I overheard a lot of the nurses talking and the techs talking, and there was a lot of fear going on, especially early during COVID, and questions about should they let this patient in who has a fever, but the hospital wouldn't let them come get dialysis, so they sent them back to the center. And there's a lot of stuff going on, so the fear was ramping up, so forth. So I saw in-home dialysis as a way for me to control my environment. I know what the situation is. I know the cleanliness of my home, and I'm not around other people. So I saw that as a way of actually helping, with the COVID situation.
Okay. So what was the training like for you for the home hemodialysis?
First of all, they trained me on home dialysis machine, which is a different machine, in the center for about 3-4 weeks. They wanted to make sure that I was going to feel better, that it would be worth the extra effort. And once I found an immediate improvement, which I did, then I went to a different training center where I was in a room with 2 nurses, and they sat with me during my whole dialysis for a month, training me on, hands-on what to do with the machines and what to do with all the supplies and what to do, all the paperwork and iPad work and so forth. So it was very hands-on training.
Okay. So prior to receiving your transplant, you also you had used the home hemodialysis, first in center, then home hemo, and then you did your own home hemodialysis. Did you have any concerns initially with inserting your needles?
Okay, yeah, I'm still on the home dialysis now. I don't have a transplant. I think that's a typo.
Okay.
That's fine. But yeah, absolutely.
Yes, okay.
The first day they handed me a needle, I had to prove to my I have neuropathy in my fingers. I have eyesight that's a challenge because of this. So I had to prove to the people that I could actually cannulate myself, and that was a challenge. And it took me a couple months to where I felt very comfortable doing it. Now it's one of the easier part of my sessions is cannulating myself, but it's a big mind wall that you need to get past. But once you realize how easy it is, and it just becomes, like I said, one of the easiest part of my sessions.
Okay. So did you have any virtual training during that time?
They had me watch a lot of videos and go through a lot of presentations online, but all my training was in person. And then I also had training in home as well.
Okay. And were you comfortable with the training both in center and at home?
Oh, I had absolutely the best trainers. They they made it personal in the fact that I wasn't just a patient to them. I was somebody. You know, we got along, we talked, we had 3-4 hours a day, you know, together. So we created a bond where I trust them implicitly, and I knew they were looking after my best interest. And it was a pleasure to actually talk. And I miss now not being able to speak with them on a regular basis.
Uh-huh. So I was curious, did you have any challenges storing your supplies?
With my supplies, absolutely. I live in a very small apartment, a studio, and I didn't think I'd be able to keep all the supplies in my apartment. And the nurses on the home visits just immediately took control, and we put things under my bed, we put things in my bathroom, we put things in my kitchen, we put things under my table. I have, you know, one of my nurses found a used medical cart for me, and we brought that in, and they helped me pack everything in and, you know, help me find out where things should go. And while it's not probably the best for a stylist point of view, but it's very capable. I'm very, you know, everything works right now. I'm able to keep everything and still live comfortably.
And it sounds like you had a lot of support from your center.
Oh, ton of support.
Great. So some people talk about isolation during COVID-19, and using home dialysis lets us stay at home, which is even more isolating. So because we don't need to go to the clinic 3 times a week. Do you have feelings of isolation? And if so, how do you cope with them?
That was a major fear of mine when I left the center, because that was my one area of socialization was in center. And I felt I'm a social guy, and I talked with all the dialysis techs and the nurses and the other patients. And that was a wonderful part of my life. And when I did home dialysis, of course, that was a major concern. And for a while, you know, I've gone through little bits of depression, but then I got my family involved, and I have social media, Facebook and other things where people were checking up on me and talking to me. I've learned what a Zoom meeting is, which I didn't know before COVID. And, you know, and things like this webinar and support groups. I do a monthly support group now. I've had to actually take control of my own, you know, my own way I'm doing it, and not just wait for people to give to me. I had to, you know, search out a few things. So, but I feel so much better now. And in some ways, I'm more connected with my friends and family now because I'm seeking out them.
Hey, so what recommendation would you make to someone who is thinking about using a home dialysis treatment but is hesitant?
You just need to realize that, for me at least, home dialysis has been life-changing, liberating. First of all, I feel better. Most people do feel better on doing the low and slow version of dialysis at home. But even more importantly is you get your life back. I am not set into a set schedule. I wake up every day and I have the flexibility of moving my dialysis to the evening or do it early in the morning. I have days off that I get to plan. I don't have them tell me what days are. And that gives you a part of your life back, even if it's just a mental part, that, you know, you have the flexibility. It's like, you know what, I'm just not going to do it this morning. I don't feel great. I'd rather do it in the evening. And that's so much better. And it gives you the flexibility to do things and to socialize and go out when you know that you don't have to have a set schedule. So.
I am right there with you, Timothy, on that one. So is there anything else that you would like to share with us?
If I can do it, anybody can do it. Most people can do it. I have mobility issues. I have eyesight issues. I can't button the buttons on my shirt, but I can cannulate myself. Like I said, my eyesight is poor. I have low blood pressure issues and so forth. I had everything, all these strikes against me, which I had to overcome, but it's worth it. And if I can do it, I think anybody can do it. And I do it by myself. I don't have somebody helping me. You know, I'm doing it all alone in my studio apartment, and that's allowed me to take control of my medical life. It's so much better than being in center, in my opinion.
Timothy, I applaud you for your fortitude, and you're a great model for all of us.
Thank you.
Thank you. So our next panelist is Althea Lee. Thank you for joining us, Althea. And okay, I hear you. Hi. And Althea is a friend. I have to admit, she's a friend and colleague. So Althea, your husband was diagnosed with kidney disease and started dialysis in June of last year. We were all adjusting to COVID-19, and you were taking on a new role as a caregiver. As a caregiver, what was it like to transition your husband to in-center hemodialysis?
Well, it was very frightening. The first thing was dropping him off at the hospital for the catheter to be put in, and then not being able to go into the recovery room or speak with the doctors. So when he was released, he came out with this thing hanging out of his chest that I had no idea what to do with or what I was looking for, and no instructions on what he's supposed to do or not supposed to do, or what I'm supposed to do or not supposed to do, other than not taking a bath or shower. I was afraid of hugging him because I thought that if I hugged him too hard or if I hugged him the wrong way, that I would pull the catheter out. So it was very fearful. And then when we went to the clinic, because of COVID, we were in very fast, dropping him off. You know, I had to drop him off and then leave. So they gave me a bag with a blanket in it, earphones in it, headphones in it, and a binder of information. So I really felt fearful and lost because I had no idea what I was looking at, no explanations on the food chart or anything. The charts that after they would give him a blood test, they would give me the chart. Well, here's the chart. I don't know what this chart means. The happy faces, the sad faces, the arrows. I didn't know what that meant. So
you were literally, oh, I'm sorry. Go ahead.
Go ahead. No, go ahead. I'm sorry.
No, I was saying, so you were literally dropped into another world.
Correct. With no one-on-one, and because of COVID, you couldn't sit down with the social worker and talk with the social worker, and she couldn't show me things, or there was no workshops, or there was nothing.
So what were some of your biggest COVID-19 related concerns, and how did you adjust to those concerns?
One of the biggest concerns was me bringing him into that center and all the people coming in and out. And the nurses were good trying to make people wear masks, and sometimes they were arguing with people about wearing masks, you know, people dropping off their loved ones, or the transport people were normally good, but the people that was dropping off, you know, the patients, they weren't so good at wearing masks. So I was really afraid that he was going to get COVID from someone in there, and as well as me bringing COVID home from going grocery shopping, you know, doing the things that I had to go do, pick up his medication and all those things. So I was very fearful of giving him COVID, and then, you know, it taking a real toll on him because of his kidney failure and weak immune system.
Okay. So what changes have you had to make?
The one biggest changes that we had to, I had to make was I had to close my private practice in order to get him to dialysis and back, and make sure that he's okay when he gets home. So I had to close my practice.
And I know how hard you worked to start that.
Very hard, yeah. He was also, I have to say, he was also my assistant. So that was, difficult for him. And I was trying not to make him feel bad about me having to close the practice. But I know he did.
Mm-hmm. So what type of support did you or do you still lean on as a caregiver? And what were the benefits of that support?
My biggest support is my relationship and my trust in God. We also have our sons who help out. My sister and friends, my sister, she comes over and visits and calls me regularly. And so does my friends that call me regularly to see what I'm doing and, joking around and all that, all those things. So my son, on his off day, one of his off days, I try not to take up too much of his time, but on his off day, he will transport my husband to dialysis and back.
Nice. And you mentioned humor and prayer. Personally, I think those are two of the strongest medicines, and you can put them in whichever order you want, but humor is definitely important to keep going through while you're going through struggles.
Yes, and also my Chihuahua. My sister gave me a dog. So my little Chihuahua is a big, big support.
So how do you take time for yourself during COVID-19?
I've learned that I had to take it. I can't schedule it. I have to tell myself this is for me, and I need to do this in order to be available for my husband. Try not to stay busy with little things and let the little things just lay off, just hold out until I could get to them and concentrate on doing other things for me.
Okay. And then what recommendations do you have for individuals who are facing coping with being a new caregiver during this time of COVID-19?
Oh, I'm sorry. Let me go back to that last question though. Some of the things that I do is I love to garden. So I have a garden outside in the backyard, and I plant in. I have above ground garden, and I also do gardening in pots. So you can grow anything in pots. I play golf with my grandchildren. I love photography, so I'm really getting back into photography. Bike riding with my granddaughter, and shopping with my sisters. So that's some of the things that I do for me, for my release.
Great. So you are taking care of yourself, a caretaker for yourself and your husband.
Right.
So what recommendations do you have for individuals who are coping with being a new caregiver during this time of COVID-19?
Well, I know that a lot of individuals do not have the benefits of having a support system. So I would say if you do, some people are too proud to reach out to people, or they don't want people in their business, and different, they don't want to seem weak or like they can't handle it. Put that aside. Think about other things that you can do once you allow support system or someone to help you. And don't look at it as being a weakness or inability to handle things. That's not what that means when you ask for help. Pace yourself, find a hobby, any kind of hobby. I don't care if it's collecting rocks, looking at rocks. Just find something that's appealing to you. Go back to thinking about when you were a kid or a teenager and the things that you enjoyed. Make that your hobby. Maybe it's drawing. Maybe it's coloring in a color book. Find something to do. Don't feel guilty about taking time out for yourself. Sometimes when we're caretakers, we feel guilty for doing things for ourselves because of what we feel that the person needs and we're not doing constantly for them. Don't feel guilty. You're doing the best that you can, and you are entitled and you deserve that time, and you cannot help that person to the fullest if you're weak and ran down. Be honest with yourself about your feelings and your fears. Everything that you're feeling and the fears about the person that is on dialysis, and talk to them about it.
Thank you. Those are some very wise words. So I believe it is time, Kim, for question and answers.
Yes, it is. And first, I'd like to thank you, Eva, for moderating, and all of our panelists for sharing a little piece of yourself and your experiences with us on this call. And we have received some questions. I also want to remind everyone who's on the call, if you have a question or a comment that you'd like to share, please submit it using either the chat or the Q&A feature of the WebEx, and then we'll go ahead and share those with our panelists. One of the questions that we received, this one is for you, Tim. The question is, what gave you confidence you could cannulate yourself?
Doing it over and over and over. I mean, they don't really give you the opportunity to not do it. It's like, you're going to do it, so do it. I mean, all the nurses were very, positive and, very, rah, let's get this done, and showed me everything the right way. But ended up just having to do it every single day, doing it every day. And repetition is what got me to the point where feeling very confident in doing it.
Very good. Thank you for that. This one came in. This looks like it's more of a statement, and it goes to you, Althea. Althea, it's really inspiring to hear of the sacrifices you made to support your husband. It's great to know how you're doing the best you can through tough and difficult times. So I wanted to share that with you. And we have a question, can either, or this is probably for, because Althea, you already shared a lot about as your role of a caregiver, but from either Darryl or Tim, can either of you talk about what role your family members played in supporting you during your transition to your new modality?
As I stated earlier, I don't live near my family right now. I'm kind of isolated in a larger city, and my family lives across the country. But I've become, I talk to my mom every day pretty much on the phone, and I talk to my brothers once or twice a week, and other cousins and so forth. People who I hadn't talked with for years, actually, are now I'm talking to, weekly, monthly basis. And even though I'm not seeing people face to face, I feel like I'm actually more involved with my family now than I have been in quite some time. And that's, due to COVID and looking for ways to stay in touch with them. So, it's something I had to initiate, but once initiated, I think it's really been a plus.
Thanks, Tim. Darryl, is there anything that you'd like to share about that? the role your
Sure.
family played?
Well, for me, I love the Althea story because my wife, when I got diagnosed, I got twin girls and they was in middle school, and my wife runs a preschool. So we were a very busy family. So the reason that I did in-center dialysis because I did not want my family to feel like they were sick also with me. So my biggest thing was I asked the Lord to just really make this thing barrel. I do my part, Lord. I just need you to not make it too much for my family. The other side of what I feel was talking about really is the side of the patient. Yes, we do worry about our family. We worry about how it affects them probably more than what's going on with us. So for me, I was trying to be protective of my wife and my girls, and I wanted to keep it far away from them because I knew I could handle my part. And my greatest wish from God was that people who knew me would tell me, "Hey, I forgot you was on dialysis," and that's kind of how I knew He was granting my wish. So that's how I handled it.
To kind of coattail to what Darryl was saying, my mother has put me on so many prayer chains, and prayer for me and with other family members and so forth, and that has been a huge part of what the family can do. So.
Thank you for sharing that. Let's see. So this one is for you, Timothy. Were there things that you heard about home dialysis as far as like myths before you started, that once you started doing them, you realized that they weren't true?
Some of the, I mean, I don't know if they technically myths, but some of the techs didn't think home dialysis. All we know about home dialysis, that wouldn't be for you, whereas some were saying this would be the best thing for you. I mean, there was some myths that I wouldn't be able to cannulate myself with the conditions that I had and so forth, and I've proven that wrong, every day now.
Very good. And Darryl, this one came in for you. You had mentioned when you received your transplant, your feeling of isolation. How did you overcome that isolation?
Prayer and I always kind of been a type person. I'm like Tim. I'm a very social person, so I did a lot of phone calls, a lot of hangout or FaceTime, a lot of things like that to get me through. My poor wife, before we went to sleep, we had to talk ourselves to sleep every night in the hospital because I just couldn't do it. We've been together over 20 years. I just couldn't do it without her. So, you find whatever is good for you to try to get through that because it was difficult because that was the first time that I had ever been in a hospital. And everybody know that's on dialysis. We have to make frequent trips sometimes. But that was the first time that I ever got to the point where no one was there except the nurse. So it was difficult, but I made my way through, thank God.
Althea, this one's for you. Now that you had a little time to think about it, what do you think some of the healthcare professionals at your husband's dialysis center could have done a little differently to include you more in your husband's care plan?
By asking me asking me what my questions are. Oh, am I supposed to write it out or? Uh-oh.
I'm sorry?
Oh, I'm sorry. I wasn't sure if I was supposed to type it or, sorry.
Oh, no, you can just verbally answer, yes.
Okay. By asking me what I needed or what my concerns were, what, if I had any questions, answering the questions about telling me about, if what happens when his veins start doing a certain thing. Just being available to answer questions or to ask me if I had any questions. I never was asked if I had any questions.
Okay. Thank you for sharing that. And Timothy, if you are interested in sharing this, someone has asked if you are currently on the transplant wait list.
Next month, I go for my evaluation to get on the list.
Okay. And they asked what interested you in getting on the list?
I want a kidney. I mean, I want to rid myself of this machine that's in the middle of my studio apartment. I want to be able the ability to travel and go back to some of the freedoms I had before. I mean, I want my body to be able to work correctly, if that makes sense. When you're on dialysis every day, especially home dialysis, where you're doing it 5 days a week, it's an everyday thing. And I'd like to have some days where I just don't have to think about it. Having to get on dialysis, having to put the needles in the mouth, and of course, life expectancy. Increase my life expectancy.
Very good. All right. Thank you for that. And Eva, I would like to ask you a question. I know we've been asking the panelists questions, and you've gone through some transitions as well during COVID.
Yes.
And hearing everyone's stories and their experiences, how has this impacted you?
Well, I had to give myself a lot of grace and patience. I moved 2 months before the shutdown to a new home. So doing dialysis, I was still working. I didn't take any time off for the move. So I'm still unpacking and getting things situated because I didn't want to have contractors and workers coming in and out of the house, or even family members to help me unpack because of the risk of COVID. And then with the dialysis and not being able to physically do a lot of things. So I've given myself grace because things are slowly getting together. Actually, today I was going to call the organizer to come in and help. So the main thing was just being patient and allowing things that I would normally be upset about or more anxiety provoking, that it is what it is, and thankful to be here with a new kidney and letting it go.
Thank you for sharing that with us, Eva. We appreciate that. And we appreciate you, again, moderating and everyone's experience on this call. At this time, I'd like to go ahead and move on. We don't have any more questions. So we'd like to kind of share a few more resources that have recently been added to the NCC website. What we have up here now is My Plan, My Care, and it is a tool to help you partner with your care team during your plan of care meeting. It offers a list of topics to discuss, including important questions to ask about your dialysis health, emotional health, and vaccinations. There's also a page to take notes of your visit and then write down any additional questions that you might have. You can visit www.esrdncc.org/patients and then select for new dialysis patients. Then look under the Being Involved in Your Care category. We can have the next slide. These two resources are helpful as you begin to prepare for travel. When you, of course, begin to feel comfortable traveling again. The tools are for those who use in-center hemodialysis or home dialysis and are planning a trip. learn how to plan, what to pack, and discussions to have with your care team. There are also travel tips to help along the way, and you can visit www.esrdncc.org/patients, then select for new dialysis patients and look under the Traveling on Dialysis category. For our final resource, we of course want to remind everyone about the kidneyhub.org. It is a mobile-friendly web app developed by NCC with a lot of input from our patient subject matter experts. It has information on home dialysis, the kidney transplant process, infection prevention, mental health, and more. A diet and nutrition section was recently added. There is information on there about grocery shopping during COVID-19, and we encourage you to check it out today. Our next Quickenar event, we invite you to mark your calendars. We have several coming up. Not all of them are on this slide. Our next provider-focused event is April 21st at 3 p.m. Eastern Time. And during the week of April 26th, the NCC will be offering several educational events. On Tuesday, April 27th, we will have a special health equity listening and learning session from 1 until 2:30 p.m. Eastern Time. So join the ESRD, NCC, and CMS as a panel of patient leaders share their experiences with racial and sexual bias in healthcare, access to care, and communication. Then on Wednesday, April the 28th, the NCC will host its patient-focused COVID-19 webinar event. So please note that change in day. And on Thursday, April 29th, the NCC is hosting a special event focusing on home dialysis titled Unplanned Dialysis Starts, a home-first patient-centered approach. Please watch the NCC website and your email boxes for registration information. If you'd like additional information, please email nccinfo@hsag.com. So again, we'd like to thank you for being with us this afternoon. I'd like to thank again our panelists and our moderator for sharing their experiences with us. So we take a little piece of you with us this afternoon. For additional information, additional COVID information and resources, visit the CASER website at casercoalition.com. Thank you, everyone. Have a good evening, and please stay safe. Take care.